Okay, so you're looking at track one moderators up at the stage. My name is Renee Cruey. I am the executive director of the Academy for Radiology Research, and I've been with the Academy for 15 years. And the Academy created 4 years ago the Coalition for Imaging and Bioengineering Research. The Academy of Radiology Research was created, as most of you know, to pass legislation which created NIBIB at the National Institutes of Health. About 4 years ago, we decided that the 30 imaging societies that are members of the Academy wasn't really sufficient enough to advocate on behalf of imaging, so I created the Coalition for Imaging and Bioengineering Research, of which we have 80 patient groups, 32 academic radiology departments, 9 industry members, and 30 imaging societies. So I'd like to thank Carmine for inviting us, because most societies have meetings for decades before it occurs to them to invite patients to that meeting, patient advocates. And Carmine did it the very first time you guys had this meeting. Who you see up here on my panel are patient advocate representatives who will probably answer some of your questions. They represent prostate cancer and breast cancer. However, they're not here specifically with those hats on. The patient advocate members of our steering committee are chosen because of how vocal they are and how much energy they have. So I asked them to come here today because I know the AIUM is interested in reaching out to patient groups with regards to ultrasound, what it is, should they ask for it, basic education. And that's what our track was in charge of today, coming up with how to reach out to patient groups. So I think after speaking with the patient advocate members and Dr. Coley at the end of the session, we all sort of agreed that the AIUM needs to come to a consensus and identify a group within your organization that is truly interested in reaching out to patient groups. Specifically, I'm not talking about your profession accreditation. I'm not talking about who does ultrasounds best, who's doing them where. I'm talking about a core group of people within your society that are genuinely interested in seeing the value of reaching out to patient groups. Because if you don't identify a group of people who are interested in just that initiative, then your initiative will probably not be successful. We have 80 patient groups. Most of them utilize ultrasound in some manner. So what we ended up doing was identifying amongst the group the main things that the AIUM members felt that patients should be informed of. And I'm going to read these off. What we did was we wrote them down. We gave everybody little stickies, and we asked them to get up off their chairs and put stickies next to the comments that were made that were most important to them, or that they thought would be most important to the patients. I'm going to read those for you. Educate patient advocacy groups to ask the right questions of their physician. Identify where is ultrasound useful and within what disease groups. Research effective information from professionals to pass on to patient advocacy groups. Patient advocacy groups should ask who is performing the ultrasound. Provide patient advocacy groups with sound judgment vignettes. Request an RFP represented from patient advocacy groups to develop information deficit ideas that the ultrasound community can research. And inform patients that not all ultrasound is the same. Now, I'm not saying that these are the points that you should communicate to patients. I'm saying that this is what the group felt was important. Some of the tangents that were discussed, accreditation was brought up a few times, training, and getting the medical community to use ultrasound. Those are not issues that you want to engage the patient groups on. Patients need to know what ultrasound is. Is it used for anything other than if you're pregnant? And is it something that you should discuss with your physician? Now, how do you as a society reach out to the patient groups? Well, several ways were discussed. The AIUM creates vignettes of information. I was told in this meeting, I don't know much about them, but I do know that if you create one that focuses on specifically what ultrasound is, what it is, simple as that, you can send that information to all 80 of the patient advocacy groups that are members of CYBER. Within those patient groups, you can identify the ones that focus on breast cancer. For example, we have seven breast cancer patient advocate organizations. One's represented here, Are You Dense? That's the name of the organization, I'm not asking you.
We know they are.
And as you know, or you may not know, a lot of the patient groups that represent diseases don't play well in the sandbox together, but they are all members of cyber. So you can reach out to all of those patient groups by developing vignettes that focus on ultrasound and how it may benefit breast cancer. If you arm patient advocates with the information about imaging, specifically ultrasound, then when they have their lobby days in Washington, D.C. every year, they will have those points, those talking points, that they can then implement in their lobbying efforts. And patient groups will be your best ally if you give them the information and if you engage in them. And one theme that I sensed throughout the members of AIUM in this track is that you didn't feel you had enough research or information to provide a lot of the patient groups. In my mind, in my opinion, and my colleagues may disagree with me if they have comments afterwards, it's irrelevant that you don't have all the information. What is relevant is that IUM start reaching out to patient groups now, because when you do eventually have that information that's valuable to them, the AIUM will be in a position to be the go-to organization for patient groups, and that's what you need. There are patient groups for every disease and condition, obviously several of them. So if you start reaching out now and making contact by providing them with newsletters or identify a member within IUM to be a point of contact with each patient group that's relevant to their expertise, that would go a long way. I think that's the summary. What the patients do not need to hear additionally are turf war stories, CT versus ultrasound. Patients are already scared shitless about CT and radiation and what it can do. Patients do not need to be any more confused about imaging than they already are. And I told you guys should have come up and done this. Patients need information about imaging and how it can help them. And the radiology community is so divided in so many different ways already. You have private practice, you have academics, you have CT, you have ultrasound, you have MRI, you have PET. And it's very rare that the imaging community actually comes together. And this is one way that you can really come together and just have a single message about ultrasound and just educate the patient groups so that they can at least become familiar with what it is you do. That's the end of my comments. I don't know if you guys have anything else you want to add to that, if I've left anything out, or if we should just go right to questions that anyone may have. Did I sum it up good?
Excellent.
All right. That's it. Thanks.